Good evening, everybody. My name is Jacqueline Adibija, and you're listening to Your Health 360. I do apologize, waiting for my doctor to be ready to speak with us. But in the meantime, let's talk. Now, this country at this time, or should I even say the whole world, as a matter of fact, there are challenges, different things that just affect you left, right, and center. It makes one begin to question, even in some cases, one's sanity. And while all of this is happening, I mean, people are sleeping less and less in the night. People are not taking care of their health as well as they should. People are not eating well the way they should. And I mean this in the manner of we're not even taking in the kind of nutritious foods that we should. At this point, people just eat what they get. And so you find that you are in a place where you don't even know what's going on with your body system. Now there is one particular indicator that is very quick, usually amongst other things, to show that, look, I'm here and all is not well with this temple that you call your body. And it is your blood pressure. And that is why we think it's really important that we talk about it, especially in these times when people are thinking about every other thing other than their blood pressure or even taking it. And that is why today we'll be talking about blood pressure matters. We're live on Facebook, so you can actually go there and drop your comments in case you want to be a part of this conversation as early on as possible. Or you could send a text message to the number 090-7270-3270. You can just send your questions or whatever it is that you want to that number, a text message. All right. And today with me in the studio, I have Dr. Amina Ismail. Dr. Amina Ismail is here, and can I just say you're welcome? It's great to have you here.
Good evening.
Good evening. Now, Dr. Amina Ismail, we're talking about blood pressure matters. What is our blood pressure? What is it?
Okay, so blood pressure, according to in the medical terms, you may not really, for the lay people, it may be a difficult thing to
just break it down,
yes,
make it as simple for us
okay.
as possible.
So let's just say, as we know, pressure, as in normal pressure that we know.
Mm-hmm.
So it's just the flow, how the blood flows through the veins, through all the veins, the arteries, or to the heart. So that's just the, let's just say, that's just the
pressure.
simple, yes.
That's the
so
simplest
the pressure
way.
with the flow, how the flow goes through the blood, that will be what we call pressure.
Pressure.
As we know, pressure from our physics, the force times area, so all those, it's just the basic. We start
physics.
from the basic.
Oh, okay, so yeah,
physics.
Yes, physics. Wow.
Yeah.
Okay, so before I launch us into a different story, when we talk about physics and the rest of it, let's focus. Now, when you go to the hospital, the doctor tells you that you have calls one number over another number when he takes your blood pressure. And then for those that are curious, you ask them, they say this one is the systolic, the other is the whatever.
Diastolic,
and then the English just manages to confuse you. So what exactly are those numbers? What's the one on top and what's the one below?
The one on top is the systolic blood pressure. That is when the heart contracts.
Okay.
So that's the maximum pressure at which the heart contracts. So that is the systolic blood pressure. While the one below is the diastolic blood pressure. That's when the heart relaxes. Yes.
Okay. Thank you for. So it's the contracting and the relaxing of the heart.
Yeah.
Okay. So why are you more concerned as doctors about? I know you're concerned about all of it, but usually it's the one on the top. And going by your definition now, it's the contracting of the heart, right?
Yeah.
That is above. So how come a lot of doctors look at that one first? Like, okay, so they look at that. They look at the one below, but usually is that one, is it 120 or 135 when it's getting to 150? Sometimes they don't even really care about the one below. They tell you this is too high.
Yeah, actually, both are important. Sometimes even the diastolic may be even more important than the systolic blood pressure. It depends on the condition mostly, because sometimes even if the systolic is high, is if the diastolic is higher or is too high, we tend to look at the diastolic, trying to we tend to try to reduce the blood pressure below the let's say maybe 110 for
That's
the
the one on top.
diastolic. No, for the one below.
Below.
Yes,
Okay.
below it may be more dangerous actually. And maybe it's your own experience or some
Yes.
people's experience.
Yes.
Yes, but
Maybe.
both are important.
Okay, both are
Yes.
important. Okay, so let's move on to a condition called high blood pressure, because we do know that we have high blood pressure and we have low
Low
blood
blood-
pressure,
yeah.
and none of them is actually good.
Yes.
So, but let's talk about high blood pressure now. What exactly is high blood pressure? Just break it down for us, simplify it.
Okay. So high blood pressure in medical terms is known as hypertension. So the normal value for the blood pressure is 120 over 80 millimeters of mercury. So when the value is higher than that, we call it hypertension or high blood pressure. Yes.
Okay, so
Yes.
when the value is higher
Yes.
than,
Than 120 over 80 millimeter of mercury, that is when we say there's a
it's
high blood pressure.
Why
Yes.
why is 120 the
Okay.
ideal?
So 120 is the average actually, but there is a range. We can say plus or minus 20.
Okay.
Plus or minus 20.
Okay.
Yes,
Okay.
for the systolic, and then for both, you can even say like
For
that.
like
Yes,
that.
but mainly the systolic can also be plus or minus 10 millimeter of mercury. So because you cannot say this must be the actual value for all individuals, there must be a range. Yes.
Okay.
And before we say a person has high blood pressure, you have to measure the BP, that's the blood pressure, over a duration of time, maybe over maybe about 3 to 4 months, or even up to 6 months. And the patient has to be relaxed, because some patients, maybe you tell them that you have high blood pressure, or some even if they come to the hospital, the fear of what they will hear or the diagnosis triggers the BP. Yes, for it to become high. So even at that, so the BP has to be taken in a relaxed environment while the patient is calm.
So how do you know people? I've actually heard this situation, this phenomenon where they call it, is it white coat
Yeah.
blood pressure?
Yeah.
Where immediately you see the doctor, your
Yes.
blood pressure shoots up. So, but in a case like that, what do you do when you
we
notice
try
that?
to. So one thing is, we try to calm the patient. When you measure it and you see that the blood pressure is high, so you just try to calm the patient, just talk about other things. Then after some time, then you can take the blood pressure again, or you can tell the patient to come at another time for you to check again.
The patient is still going to see that white coat, and then it's going to go up again.
No, we just try to calm the patient actually. When you're calm and you're maybe you can ask the patient about her family, or his or her family, all those issues. So later, when the patient is calm, then you take the blood pressure.
Okay, so
Hopefully it will become normal. You get the normal reading or the correct reading.
All right. So let's quickly, because I'm watching the time, and I know a lot of people will want to talk to you. Let's go over to the other side.
Okay.
At what point do you say this is low blood pressure?
Okay, that one we can say less than 90 over 60 millimeters of mercury. Yes. That's the hypotension, low blood pressure.
So anything below that
Yes.
would be low blood
Yes.
pressure. So what are some of the things that inform high blood pressure? Things that cause high blood pressure that could be precursors to that kind of condition.
Okay. So the high blood pressure, it can be essential and non-essential. So for the essential, that's there are those ones, there are risk factors like the blacks, we Africans, blacks in general, males. Then when the patient is obesity, then our diet, high fat diet, all those can predispose one. Then family history, when one of the parents has hypertension, there is higher likelihood for the children to also inherit it.
So that's the essential.
Yes. So then the other ones, the non-essential, are the ones that have causes. It could be from pregnancy-induced hypertension, from renal diseases, some endocrine conditions, like some endocrine. Let me just leave it as that.
So
Yes, so
some
these ones have causes.
okay,
Yes,
okay,
there are known causes, but
known
for the
causes.
other one, for the essential one, we are not. There is just you don't really know the cause, but you have factors.
Factors.
Yeah.
Okay, so what about triggers or things that could predispose one to low blood pressure?
Okay, so for low blood pressure, we can say that one is it can occur when a patient bleeds. Any condition that can lead to bleeding, maybe accidents for a woman that loses blood during or after delivery. All those can also predispose it. Then there are also some conditions. Some have when they stand up, when they are sitting and they just stand up suddenly, they may also experience hypotension, which is known as postural hypotension. Then also, some endocrine conditions can also cause low blood pressure.
For low blood pressure, we don't have the essential and
No,
non-essential.
no. We
Okay.
don't have it.
So what you're saying is, if somebody's parents did not, it suffered from low blood pressure, for instance, or one parent or both, there's no chance of it being
No. There's no known.
inherited.
Yes.
Okay.
No. It's not like the hypertension.
Okay. And so when you're pregnant,
In pregnancy, yes.
low blood pressure
is normal actually for pregnant women.
Oh,
Most
okay.
women, yes, experience low blood pressure. Yes.
Why?
Why? Because of the hormone. Mainly is the progesterone hormone. That is what affects the blood pressure.
Okay. All right. So, still with you, Dr. Amina Ismail, going back to the issue of high blood pressure, there are so many times when you just hear that someone was okay and then the person just slumped.
Yes.
And by the time they take the person's blood pressure, it's like it has skyrocketed,
Yes.
and you don't even know why. So are there things, is there a way the body tells you that, look, all is not well, even when you have a normal blood pressure? Are there ways that you can tell that, look, this normal blood pressure is like a curtain, there's something happening and I need to quickly take care of it? Are there ways?
Okay, yes. From the risk factors, if, for example, your parents, any of the parents or both have it, it's a good idea for you to be going for follow-up, for checkup from time to time. Then if the person is on the obese side, we say it's also a good idea. Then also, since we are all blacks, in this environment, it's a very good idea for us to always be going
for checkup.
for checkup. Then also, I forgot another risk factor: high salt intake is also a risk.
And a lot of our foods are really...
Yes, we don't even know what are in the food sometimes. Even the preservatives, we don't know what are used. So even all those can increase our risk. So it's better we just learn to be doing follow-up from time to time. Yes.
Which one is more common amongst blacks? High blood pressure or low blood pressure?
No, it's the hypertension. It's high blood pressure.
Okay.
Yes.
But I even have a friend who has this, and I learned that, and I stand to be corrected because we need to know that low blood pressure is actually more dangerous than high blood pressure. Is this true?
Both have their own dangers, actually. Low blood pressure, depending on the cause, if it can be managed at that time, it may not really be as dangerous as the high hypertension. Yes, like if it's the bleeding case, if the patient is transfused urgently, given fluids and managed appropriately, there will not be any cause for alarm.
So for her, this particular person I'm talking about, I don't know how she came about it. I know she's told me that she had a difficult labor at some point, but this
she
low
was
blood,
pregnant.
the low blood pressure thing, she's a mother,
Yeah.
but the low blood pressure thing right now is a part of her life. And so it's from her that I heard that, she's been encouraged to take salty
yes. Some actually, if you don't get any cause, that is how their own blood pressure is. Yes, so it's advice for them to increase salt intake
without cause, just like that.
Yes.
Okay. All right. So we're going to go on a quick commercial break. But before we go on that quick commercial break, let's talk about because I'm trying to get in as many questions as we can before we open up the phone lines. Let's talk about some of the preventive. You've talked about ensuring that we go for regular
checkup,
blood pressure
checkup,
checkups. But
yes.
how often? And what are some of those other things that we can do to ensure that we don't fall victim of this? Because right now in Nigeria, all of us, when you say you think too much. Don't think. It's almost like you are asking people not to breathe.
Yes, stress.
Yes, because the stress is much.
Yeah.
So you go for regular checkups, but how often? Because I've heard also that if you go for your blood pressure reading too often, that in itself could trigger blood pressure. Is this true?
No, it's not true.
Okay.
It's not true.
Okay, so it's not true.
Yes.
Okay. So what exactly would be the ideal?
So the ideal for me, for younger individuals, maybe twice in a year, one can even buy the digital, the one you can use at home. And if you know the normal, you should be you should be able to know the, as from what I said, you should be able to know the normal. So anytime you see any change, you can go and see the doctor. But for older individuals, maybe from 45 and above, it's advisable for them to go to the hospital maybe every 3 to 4 months.
Every 3 to 4 months.
Yes.
Okay. So what about every week? That would be too much.
It will be too much.
Be
Unless
too
if the
much.
patient is a known hypertensive
Okay.
already. Yes.
Okay. All right. So you're listening to the voice of Dr. Amina Ismail. She is with us in the studio, and we're talking blood pressure matters this evening on Your Health 360. We do know that right now, the average Nigerian should know exactly what's going on with their blood pressure. We'll be right back after this commercial timeout, and immediately we do get back, it will be time for you to ask Dr. Ismail what you might want to ask her. Do stay with us. Your Health 360 with Jacqueline at Davidja. Your Health 360, only on Invicta 98.9 FM with Jacqueline. Your Health 360, only on Invicta 98.9 FM. Well, thank you for staying with us through that commercial timeout there. Still with Dr. Amina Ismail in the studio. And we've been talking about blood pressure matters. Like I told you, we're live on Facebook, so you could actually go on Facebook and check out our live feed and then drop your comments so that we can take them. If not, you could actually send a text message to the number 09072703270. The lines are now open because we do know that this is a very, very common situation in our society. As you've heard from the doctor, not only are we Africans who are predisposed to hypertension especially, we are also a people whose diet right now many of us cannot predict or even plan. And so time for us to talk to you. Are you a blood pressure patients with hypertension or hypotension, whether high or low? You could talk to us this evening. Send in your questions, talk to us. And the lines are open. The numbers are 081 400 989. Once again, that's 081 400 989. And then we have 070 87 800 989. That second number is 070 87 800 989. All right. So while we wait for those calls to come in, and then of course I'll be checking our live feed to see if we have any questions there. Dr. Amina, I would like to ask about when this situation where you are feeling your heart pounding. Many times doctors have called it palpitation.
Yes.
Does it automatically mean that you are having high blood pressure, or having heart palpitations could actually be separate from having high blood pressure?
Okay, hypertension can cause palpitations, but there are also other causes of palpitations. That's the awareness of your heartbeat.
Yes.
Yes. So, or even when you exercise, you will feel the palpitations. Some other conditions, even some drugs, can make you have palpitations. And there are also some other conditions, maybe endocrine conditions that can cause palpitations. Sometimes most of the anything that can increase the activity of the body may cause the palpitation.
Okay.
Maybe that's like the exercise, and other than some disease conditions
That
like
isn't
hyperthyroidism. Yes,
okay, could
yes,
actually cause that too.
yes, yes.
So, but doctor, what about when it's accompanied sometimes by pain? Some people will tell you that they feel this sharp pain in their
Okay.
heart region. Some people say that I've heard some doctors say, okay, that sounds like angina.
Yeah.
But what does this mean? What does it really mean? Does it also have a link? Does it have a link to blood pressure issues or not?
It could be a link or not. If a patient may have or other heart conditions that can cause that. When you say angina, that's pain. Angina pectoris, that's chest pain. Some may point to the heart area. It
Okay.
may not. The blood pressure may be normal at that time. Yes, it's not all cases that have high blood pressure. Some it will be a cardiac arrest that is about to an impending cardiac arrest. Yes.
Okay.
Yeah,
Oh,
it
an
could point.
impending.
Yes, it could
Okay.
point to disease condition within the heart. Yes,
Okay.
maybe one of the blood supply of the heart may have issues. Maybe there is a blockage along the veins that's of the heart. Yes. So
Okay.
yes,
Okay.
even that one can also cause that
Cause
pain.
that kind of
Yes.
pain.
Yes.
Okay. So I see that it's only Sonny Billion that has sent us kudos. He says hi to you, Dr. Amina, but we don't have any other
Hello.
question. So,
Okay.
but let's go on. We have quite a number here. It's just so that we keep the conversation between ourselves and our listeners. Probably they're having a good time listening. So, what can unchecked high blood pressure lead to?
Okay.
When
So
it's unchecked, you don't know probably
okay.
that you're beginning to develop a situation like that. What could it lead to?
So it could lead to stroke, as we all know stroke. We know what stroke is. It could also lead to renal failure.
Okay, so this is
Yes.
why many times you hear people who have high blood pressure somehow develop renal
Yes, yes,
disease.
yes. There's a
Okay.
correlation between the kidney and the heart. Yes, because the kidney also assists in regulation of the blood pressure. So when the kidney fails to excrete all the toxins from the body or excrete water and sodium, so the blood pressure will increase automatically. Yes,
Okay, so
yes,
we're
they work
looking at
hand in hand.
stroke and renal failure
Yes, those are the main ones.
that high
Yes,
blood pressure could lead to.
yes.
What about low blood pressure? What could it lead to?
So low blood pressure. So most of the patients may faint, loss of consciousness.
Okay.
You cannot really, low blood pressure is not really like the hypertension per se. It's mostly associated with, how I told you in the beginning, it's mostly associated with disease conditions or conditions that can occur, like the bleeding cases I told you. Or even somebody that has a profuse vomiting and diarrhea can also develop
Low
low
blood
blood pressure.
pressure.
Yes, at that time. So it's not like you can point to it's complicated. What you can say that is just really, it's mostly related to the disease condition that led to it.
Okay.
Yes, but for those that have postural hypotension, so maybe they are the ones that you say. So that one, when they fall, is injuries that they may sustain.
Okay.
Yes, because sudden fall can predispose one to sustaining injuries.
So let's talk about this sitting down and then suddenly standing up. And then for some people, they lose consciousness. For some others, they start to feel dizzy. Is it a symptom of high or low blood pressure? I know you've talked that it's for low,
It's
but I
low.
know many people too have said, look, I'm feeling dizzy. For some people will tell you that the first symptom or whatever that they had that prompted them to go to the doctor was, a sudden change in their posture, most of the time standing up, led them to feeling dizzy, like they
Yes.
wanted to fall.
Yes.
Some people fell,
Yeah.
and they realized that they have high blood pressure.
Yes.
So, which one is it? This postural.
It's low blood pressure. Immediately, especially when a person has been sitting or lying down for a time,
Right.
for some time, then just stand up suddenly. So the BP, the blood pressure can go down, can just fall suddenly. So one will feel dizzy. But it doesn't mean that that's not the only cause of dizziness. You understand? So there
Yes.
are other causes of dizziness that can occur. Maybe when a person has low blood sugar too, one can also feel dizzy.
Yeah.
Yes, some other conditions can also make one feel dizzy, not only low blood pressure.
Not only.
At that, yes.
Okay. All right. So talking about this dizziness, still staying on that matter of feeling dizzy and all of that, what would your advice be for someone who has taken note of this and has been told that, you don't have low blood pressure, because you said this is usually unique to
Yes.
people who suffer from low blood pressure.
Yeah.
So you've been to the doctor, he's taken your blood pressure, and you don't have low blood pressure. He's satisfied
Your
with what
blood
he's
pressure
saying.
is normal
Yes.
for a normal person.
For a normal
also,
person.
then we investigate. We investigate for other causes. Yes. Some, it could also be from seizure. Maybe epilepsy can also cause one to feel dizzy before the attack starts.
Okay.
Yes. We investigate other causes.
Okay.
Yeah.
Well, still waiting for your calls this evening. The lines are open right now, and the numbers are 081 40,000 989 and 070 87800 989. Do we know everything about blood pressure? Let's talk about high blood pressure and how the treatment of high blood pressure affects, or even low blood pressure, because we're talking blood pressure today, whether
Yes.
high or low,
Yes.
how those treatments might affect a patient. You know that sometimes, or most of the time, our cough medicines that deal with, the common cold and all of that,
Yes.
they tell you when you are taking this, please don't operate machinery, don't drive,
Yeah,
because
yes.
the tendency for it to make you dizzy or something is
Yes.
there. So when you are taking, okay, we have a call here. Let's take those calls as they come. We have a call. Let's hear this person. Hello, good evening. Unfortunately, that call got dropped. We'll take your calls as they come. So, but how do these medicines affect patients?
So these drugs, there are different classes of drugs. It's not a single drug that is used. We have calcium channel blockers. We have diuretics. We have angiotensin receptor blockers. We have angiotensin converting enzyme inhibitors. We have beta blockers. So
All of them towards
yes,
treating blood
yes,
pressure issues.
Yes, we use them to treat blood pressure.
Okay.
Hypertension,
Okay.
treat high blood pressure. So it depends on the drug and the response of the individual to that drug. Yes, like each class of drugs has its own side effects, and it has how its mechanism of action. So maybe some, like the diuretics, mainly what the diuretics do, they reduce the sodium content mainly. That's what they do. Sodium, water, and potassium.
So those are the
Sometimes-
ones that you take and you find yourself going to pee often.
Yes.
Okay.
So you see, their side effect could be dehydration when the when the person
When you're
goes to
taking-
too much passing of urine.
Urine.
Yeah, so it can lead the patient to become dehydrated.
I'm coming, doctor. We have calls. I don't know. I think there's something wrong with the network. So
Thank you.
let's take the calls as they come. Hello, good evening.
Hello, good evening, sister. Welcome. Am I with Jacqueline?
Yes, you are.
Am I on with Victor? Okay.
Yes.
Please, I want to know. My name is Mr. Chukwantoni.
You are welcome, sir.
Please, I want to know the measurement for one to ascertain that he or she has this low blood pressure. just like as the doctor mentioned that below the diastolic, if it is more than 90 or up to 90,
That's
why
the
the
one
systolic
below.
may want
The one
The
below.
one below.
yes, the one below.
Yes.
So I want to know the measurement so that somebody will ascertain whether he or she has the low blood pressure.
Okay. It would have helped, sir, if you could tell her what your reading is, so that she would
Have
know.
you measured it? Did you just measure it now?
Hello?
Hello? Did you just, Mr. What's his name?
Mr. Chukwu Anthony.
Okay,
Mr.
Mr. Chukwu.
The measurement for measuring this low blood pressure, for one to know that he has low blood
Yeah,
pressure.
but what I'm asking you now, did you just measure your blood pressure now?
No, I didn't. I just want to know in case so that if I know, I will measure it and know.
Okay, no problem. We'll answer your question.
Okay.
Okay.
Okay, doctor.
All right. Thank you so much, Mr. Chukwu Anthony. Still taking your calls. As soon as those calls come in, we will take them. But you were saying something,
Okay,
Doc,
about
about
the drugs.
the way they
Yeah,
affect us.
yes. So these drugs, it depends. What I told you, as I told you, it depends on the class and the mechanism of action. So like the AC, like for the diuretics, what we commonly used in our environment is Bendro. Well, I'm sure you know it. In in the Hausa setting, they say Mekan Kadangari.
Oh,
Yeah,
okay.
yes. Most of our
Okay.
people, that's what they say.
Okay.
So then we also have the ACE inhibitors, that's the angiotensin converting enzyme inhibitors. Those example is the lisinopril. That's what we use commonly, but there are others, they are captopril. Yes.
There's
so
just so
that
many of
one,
them.
yes,
Yes.
it can cause dry cough. Yes.
So in these situations, you're
an
talking
allergy,
of
yes.
an allergy.
Yes, like edema. Some will develop angioneuritic edema, as in some will just come with swelling of the lips.
Oh.
Yes, you just see. It depends on the individual, actually.
Wow.
Yeah.
And then sometimes you might not even know. So this is why it's really good when you're taking a drug, you go back and
Yes.
talk to your doctor about what you're saying.
Yes.
Which one of them causes this one you're talking about, the swelling? Amazing. We have a call. Let's take this call. Let's not forget Mr. Chukwu's.
Yes, his question.
Hello,
I'm
good
sorry.
evening. Unfortunately, that call got dropped. Can you answer Mr. Chukwu quickly before we move on to
Okay, as he asked about the
low?
diastolic,
How do
that's
you
the one
know
below.
that you're,
Okay. I said less than 60.
less
The
than
limit of
60?
mercury, yes.
Okay.
Yeah.
So usually 90 would be ideal,
Yes,
right?
yes.
But when you are
Ideal,
finding
yes.
yourself going
Below
below
the-
60.
yes.
Okay, so we have another call. Let's take this. Hello, good evening.
Hello?
Yes, you're welcome. You're too close to your radio.
Good evening.
Good evening.
Yes, I'm Uncle Sam from Sabon Tesha.
You're welcome. Go ahead. Your question quickly.
Hey, something happened to my elder brother.
Okay.
He was having high blood pressure. But all of a sudden, the pin dropped down. What is the antecedent? I want to know the difference between high blood pressure and the low blood pressure.
But this is what we've been talking about since. Are you just joining us?
Ma, what I said,
Is he
doctor?
on-
Are
is
you
he
just
on
joining
drugs?
us? Is
Yeah, I'm just dialing on.
Yeah, okay. We've actually been talking about the differences, but what's your brother been on? Has he been on any medication?
Yeah, he has been trying his whatever thing.
Okay.
But please, in a situation like that, I want to know what is the real cause of it. High blood pressure.
Okay. All right. I think the doctor will wrap this up when she's about to go because she has talked about it before.
yeah.
But let's talk about, because I know there are people who might be listening for, how these drugs affect the patient. So
Yes.
we've talked about you might find
Classes, yes. So then also another class of drugs is the calcium channel blockers. These examples of drugs from this class, we have amlodipine, nifedipine. So these ones commonly headache, may cause headache. So some of the
Wow.
patients, when they commence it, complain of headache. but some may resolve over time, but some may not tolerate it, so one has to change the drug.
So, how long do you want a patient to be on a drug before that patient can come back and say, doctor, this isn't working. The side effects, I cannot
So
deal
let's
with
just
it.
say, depending on the class, but let's just say 2 weeks,
2
2
weeks.
weeks to 1 month, but mostly we give 2 weeks.
Okay.
So when the patient comes, we check the blood pressure and we know whether it's regulating, we are regulating the blood pressure or not.
So we've personally talking to people as a health journalist, I've heard some people talk about side effects that you have nightmares, that's bad dreams, and they've been linked back to
The,
blood
drugs.
pressure drugs, and some will even tell you that it affects libido. They are
Yeah.
unable to
Yes, for
satisfy
men,
their
yes.
spouses, especially men.
Yes,
Which
so
one?
we avoid it. That's the alpha metal. That's the alpha blockers. Alpha
Are they the
agon,
same
sorry.
that cause nightmares? The
no,
bad
no,
dreams?
for the one that causes low libido. That's the Aldomet. That's alpha metaldopa. That one we don't is for a doctor that knows what he's doing. Actually, we don't prescribe it for males. Yes.
Okay,
For
we have a
that-
lot of calls coming
Okay.
in, so that I don't
Okay.
colonize you alone. Let's take calls. Hello, good evening.
Good evening. How are you?
You're welcome. Thank you very much for asking.
My
Your
name
question.
is Victor.
Go
I'm
ahead.
calling from Rodney.
Okay, go ahead.
Please, is treatment for BP for life?
Okay, all right. Is that your only question?
Because I've had people say that I've come across people who have been on that treatment, who have been on BP drugs for as long as 10 years, 15 years, 20 years, and they tell me that they have to be on that drug.
Okay.
It's either monthly or as long as it is given to them, they have to go back when it is finished. Is it for life?
Okay, all right. We'll take your question. Should BP drugs be for life?
Yeah, it depends. If it's the essential hypertension, actually it's for life. Because
So
we
once
want to-
again, so that those that are just joining
Yeah.
us, essential hypertension is the
Yes.
hypertension where there's
the
no known cause.
known cause.
Okay.
But there are risk factors. Like I said, blacks, males, high sodium intake. Those are the
Obese
obesity.
and
Yes.
hereditary.
Yes, hereditary,
Okay.
familial. Yes.
Okay. Okay.
So, and then the non-essential are the ones that have causes like pregnancy-induced hypertension, renal diseases, some endocrine conditions.
So that one can, after, if the foundational problem is
Yes.
solved, they can.
Yes, those
stop.
ones can stop it.
Okay.
Yes, that's for the non-essential.
Before we took that call, you were talking about which one of those blood pressure medicines causes bad dreams.
Right. Okay.
But you
It
said
could
2
be-
weeks, right? You said
Yes,
2 weeks.
yes.
Usually, you use that drug within 2 weeks. If you're not happy with what you see your body doing,
Yes.
you come back
Yes.
and get that reviewed. Now, there's something that I also, I don't know, you could tell us that even for women who are on like Aldomet, like you said a doctor who knows what he's doing would not
Yes, for
recommend
the
Aldomet, I beg your pardon, for a man. So, but for women who are taking Aldomet, I also learned that if that patient starts to have a higher body temperature, it just means that the Aldomet isn't right for them. Is this true?
So this Aldomet, mainly we use it for. It's not for women. Actually, we use it for in pregnant women.
Okay.
We use Aldomet and the nifedipine because it's not all the drugs that you can give a pregnant woman. But I don't know, where did you hear about this high temperature?
Oh, okay. Well, it was something I came across.
Okay, you read it somewhere.
Yes, that
Okay.
when a woman is starting to have that constant temperature that is slightly,
Yes,
when
yes.
people touch you, they're like, wow, you're warm, and you are or have been on Aldomet, that it's a sign that you
so
need
we
to.
can change the drug. If
Okay.
it depends, there are many side effects actually, and it depends on the individual. It's not all individuals that experience the same side effects. It's not all individuals. Everybody is individualized. That's just it. So if we notice the side effect is preventing the patient from his or her normal activities, so we may change the drug, or we can decrease the dose. All those are
You
some
know,
of the
adjustments
we
can take
yes,
place.
Yes, adjustments
All right,
can
so
take place.
we're running out of time, but you know, when we're talking about headache, you talked about one of the drugs or a
Yeah.
group
Yes,
of some
of
of
the
those
drug.
drugs having
Yes.
headache as one of the side effects.
Yes.
How does a patient know when this headache is actually headache that is coming as a reaction to that
Okay.
drug and not just that I'm stressed or that
Okay.
it is the BP itself, I mean the high BP itself that is causing the headache? How do we differentiate?
Okay, some of the patients will say they started experiencing the headache when immediately they commence the drug, maybe after the first day, second day. So, and then some will also treat other conditions in our environment. We know malaria can also be a cause of headache. Some will treat the malaria, but still the headache will persist. Yes.
So in that
that's,
case,
yes.
you actually need to
Yes.
change.
So if we change it and you notice that the patient doesn't complain again, so it means that it's that drug that caused the headache, most likely.
So as a doctor, you would encourage that people who are taking drugs are there medications for low blood pressure? Because I don't think I even asked that. We've been
It dep-
concentrating
yeah.
on high blood pressure. What about for low blood pressure? Do we have medication for that? Or is
So
it just
depends.
lifestyle?
Well, how I told you it depends on the cause. If you treat the cause, most likely the blood pressure will normalize.
Okay.
Yes. But for some conditions, there are some conditions that you may give, like some endocrine conditions, you have to give some drugs. Yes. Like some endocrine
Yeah,
conditions.
okay.
Yes,
So you
yes.
have to like treat the
Yes.
foundational issue.
Yes.
Okay. So as a doctor, what would your advice be to those who are listening about how their relationship with their doctors should be based on their medication?
Okay, when one wants to prescribe the drugs.
Yes, when a
Yes.
doctor has prescribed for you, you go back home. I know a lot of people who will tell you that they've been on this particular blood pressure medicine for 10 years,
So if
15
it's
years, 20 years. Is that even right?
Yes.
For you to be on a particular
Yes.
blood pressure drug for years?
Yes. If that drug is controlling the blood pressure,
Works for
it
you.
works for the patient. The patient will be on it. Like I told you, if it's the essential, the patient has to be on it for life.
Okay.
Yes.
So, but if the person is having, side effects, then of course the person needs to go back
Yes. Yes.
to the doctor.
Yes.
And you keep going back as long as you keep having side effects.
Yes. Even without the side effects, you're supposed to go back to the hospital for follow up.
Okay.
Yes. Yes.
Even without side effects?
Yes. Even without side effects.
All right. So let's
Yes.
take this last call. Hello, good evening.
Hello, good evening, doctor.
Your last caller. You're too close to the radio. Please move away.
All right, thank you.
Yeah, go ahead.
My question is that I have high blood pressure,
Okay.
and in the morning, when I wake up in the morning, I fell from my bed.
You fell.
I fell on the ground.
Okay.
When I fell on the ground, so my wife and my children then picked me from ground to bed. I
Okay.
spent like 30 minutes before I wake up.
Oh, so you were even unconscious.
Yes, all my room was turning like pound.
All is what?
So from there, they rushed
He
me
was
to hospital.
He was dizzy.
Okay.
And the doctor prescribed me medicine. I started taking it up to now.
So, and it's high blood pressure.
Was that your first
Yes.
time? Or were you
That
on
is
drugs
my-
at that time?
That is my first time.
Okay. So then you didn't know you had the high blood pressure when you fell?
Yes, yes, doctor.
Okay. So it could be from the high blood pressure.
Okay,
Yes.
thank you.
Okay,
You're
thank you
welcome.
very much. Now, this patient just talked about something that I was trying to
Yes,
ask you.
yes,
That
yes.
it's not only low blood
Yes,
pressure
yes.
where you just get up and
Yes.
then you find yourself.
No, that was so you cannot really. If I said what I said is if the BP is measured, and the BP is low, so that one we may say is postural hypotension. But as his own, that was his first time. He didn't know that he had the high blood pressure, but
Right.
that was the first time he was diagnosed. So the high blood pressure it could also be a sign. Yes.
The
like
dizziness,
dizziness, headache.
passing out.
Yes, some
and
will
all of-
even complain of weakness. So,
Okay.
yes.
Okay. All right. So, and it's now that we don't have time that the calls are coming
Yes.
in. I don't know what we can do. Hopefully, maybe next time we can talk about this. But, Dr. Amina, as your last line, what would you tell people about, the blood pressure, your advice as a doctor to
Okay,
all
my
of us?
advice is a lifestyle modification. We are exercising, reducing the high salt diet, eat our consumption of fruits and vegetables. Those are the advice, and then the regular checkup. Yes.
Regular checkup.
Yes.
And I guess exercise too,
Yes,
since you have
exercise
said
to stay fit.
obesity.
Yes, obesity.
Stay fit.
Yes.
Nowadays, a lot of us walk, not because we want to exercise, but because there's no money. So I think a lot of Nigerians are exercising right now. But, that's just on the lighter side. Do get your exercises in. It's very, very important. I'd like to thank you, Dr. Amina Ismail, for being here with us to talk about
You're
blood
welcome.
pressure matters. It was great listening to you. I hope you were able to take away something important. However, it is very, 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 very important that we take the checkup very, very seriously. Please ensure that you check your blood pressure, and let's just try the best that we can. Get those fruits and vegetables in as many times as we can into our diet, and of course, continue to stay within Victor. Remain victorious and have a great weekend ahead. Until next Friday.